Good morning, good afternoon, good evening, St. Paul's alumni crusaders. My name is Jason Kopytko. I am actually the president of the St. Paul's High School Alumni Association. On behalf of the St. Paul's High School Alumni Association, our president, Kevin Booth, and the staff of students at St. Paul's High School, I would like to welcome Dr. Ryan Zarychanski, a graduate from the class of 1992. If you don't know already, Ryan is a critical care physician, hematologist, and a clinical scientist at the University of Manitoba and Cancer Care Manitoba. He is currently leading a clinical trial to see if the drug hydroxychloroquine used to treat malaria can reduce the symptoms and spread of COVID-19. Welcome, Ryan.
Thanks for having me, Jason.
Thank you. Let's maybe start off, and usually with these interviews, we sort of start off like your time at St. Paul's, but I'm really curious right now because it's very relevant. You know, as a graduate from the class of 92, can you tell me like what sort of led you from St. Paul's to where you are now?
Sure. I mean, do you want the long story or the short story? But I did a 3-year degree in science. Spent great summers working at St. Charles Convent while preparing for medicine, which was a great summer job after St. Paul's. Then I went to the University of Ottawa for medical school, did internal medicine, hematology, critical care. Went back to Ottawa for some research training, and so became a perpetual student. I was a university student for 16 years, I think, but I really enjoyed the time and it really prepared me for what I'm doing now.
Good. So you're part of this clinical trial. What can you tell me about hydroxychloroquine and what do you hope to accomplish from the trial itself?
Yeah. So in fact, we have a suite of trials. So we in response to COVID-19, I think it was important to provide an opportunity for Manitobans to get experimental therapies in a situation where no treatment existed. And to take one step further, one step back, that is, I as part of my job, I do clinical trial research. And so I try to find therapeutics, drugs or devices or treatments for people generally in the intensive care setting and at the intersection of hematology and critical illness. So those are my two clinical specialties. And so I do clinical trials in bleeding or transfusion or drugs that modulate someone's ability to clot or prevent them from bleeding. And so we have several trials ongoing around the world in those domains, and they have to deal with sepsis, that is a severe infection, and trying to uncover therapeutic targets that relate to blood and hematology, but also to people with severe infection. And so right now we're treating patients with severe infection with a blood thinner that is related to a trial that we started earlier this week, actually. And so then fast forward to the present, which is COVID-19. COVID-19 came upon us at some capacity. We saw it coming from China a few months earlier, then into Europe, and then into North America. And no treatment options are available. And so as a physician, you kind of want to do something to people who are really sick, but it's irresponsible just to give people drugs and not know the real treatment benefit or the risks, despite what might be purveyed to us by senior leaders in the United States. And so that's not a responsible way to do medicine. We want to know what works, what are its side effects, and if it does work, should we be giving it to everyone, or should we pivot our energy and focus on something else that may work and has acceptable side effect profiles? And I think early in the course of COVID, we wanted to flatten the curve, and I thought, well, okay, well, I can start a trial that will help flatten the curve, and so we started a trial that was an international trial with Canada and the United States in collaboration, where we did study hydroxychloroquine because there was some early lab data that suggests that it may have some antiviral properties. And we gave it to people who were newly diagnosed, but they were outpatients, or they were people who live with COVID-19 patients to see if we can reduce the severity symptoms in people with the disease or prevent the transmission of the disease to people they live with. So that was the first trial. But then it became obvious that it became obvious to us that there are no treatments in any of COVID-19, and we had no treatment options for people in the hospital who were sick or in the ICU who were fighting for their lives. And so what I did is I just pivoted my research staff, and I met with them one day and said, there's not a lot of capacity to start clinical trials quickly in Manitoba in their existing research teams, but we can do this. And so we do this all the time in the ICU. We're used to dealing with sick people. So why don't we just stop what we're doing for a few months, start trials for everybody, and we'll prioritize the trials. You guys are well trained. I know you can do this. And so what we did is we identified trials as outpatients in the hospital, on the ward, and in the ICU at every spectrum of disease severity that were relevant to patients that we saw. And we said, let's identify a trial that exists in the world and let's be part of it. And if one trial doesn't exist that we need, let's start it, because we can do that too. And so let's be great participants in a world in a world where we need to collaborate. And if a trial doesn't exist for a target that we've identified, let's lead the world, because we can do that too.
So are you sharing sort of results or sharing some of your information with other scientists, I guess, down in the US and internationally?
Yeah, so the world has gotten a lot bigger, a lot quicker for all of us. And so the days are full of teleconferences where we're planning, strategizing, and sharing. And so we have started 7 international trials that are being held in Manitoba now. Like 3 of them we're leading, and so I'm leading those trials. But for the other ones, we're really active participants, or maybe Canadian leaders or provincial leaders. And so yes, we're sharing all the time, and at a global level with many countries. And the idea is that trials usually take years to start and finish, but no one wants to wait that amount of time. We want our trials done within 6 weeks to like a few months. And to do this, we're going to have to work together internationally. And so some of the trials that we already started, like the hydroxychloroquine trial you mentioned, is actually already over. We haven't reported the results yet in the public, but that's how quick we're able to do these, by working together.
Wow.
Instead of being protectionist and all worried about who gets credit and who does this. Like, let's just work together and get the answer. And so we actually have that answer. And I really wish I could share this right now on the phone, but for lots of very important political reasons, I can't get today. But maybe next week we could. But suffice to say, the answer is coming really, really soon, and people are waiting for the result. Like, and one of the investigators even got a call from the White House on the weekend trying to figure out what the result was. But this is how tight we have to be with this just this week. So we are working together.
So last month, the Manitoba government sort of announced their 3-phase plan and rolling out as things are slowly starting to open up. When do you foresee, the time that maybe we'll actually get back to some type of being normal like it was before, or is there just going to be a new normal overall, how things are going to work? So, and we always, and then the second question I'm going to ask is, we keep hearing, especially on the media and stuff, and you see it on social media, that there's a potential second wave coming. So I guess, just to hear, I'd like to hear your response to say, like, how do you think, when do you think we'll eventually sort of turn that corner, or are we going to have to be more cautious enough with the potential of a second wave coming in?
Yeah, I mean, I'm a clinical trialist and a hematologist and critical care physician. I don't fancy myself to be a WHO coronavirus expert. Just want to say that, but I'm clearly invested in what's going on. In the absence of a vaccine, it's hard to imagine this will go anywhere quickly. That said, SARS, which is related sort of virus, did go away, but I don't think this is going to be that way, and that's what the epidemiologic data is telling us. It's an RNA virus that mutates quickly. We will we'll have more infections in Manitoba and in other provinces around the world. As we open up our economies and go back to work and kids go back to school, there'll probably be other waves, as you said, like in the fall or otherwise. It's our expectation that we could manage those along the way. I think that I think the key message is that we'll have to be flexible and roll with it a little bit as a society. We don't know lots about this, and we're gaining knowledge all the time with regard to clinical trials that I'm involved in, with regard to the epidemiologic data in infection rates, attack rates, replication rates. So we're learning about that, and so it's impossible for us to say this is the strategy based on our knowledge, and we're going to not deviate from that strategy as new knowledge acquires. That's not possible. And so what we think today might be different from what we think tomorrow. And this is my world. I feel like everything changes that quickly. But what we are planning this week may not be what is the right strategy in 4 months from now when we see another wave, and we might have to reinstitute some of the measures that were taken away in certain places. We'll definitely have to be intellectually flexible. We'll have to be flexible in our behaviors. And that might wax and wane over time.
So it's constantly very much sort of adapting to the new situation, and again, like you said, that the norm for today be a different norm next week than what we thought it was going to be too. So
yeah,
it's just,
I think so.
Right, just flexible.
I think we're going to have to be flexible, and that might be challenging for some people who just want to know the answers now. And then when the answers change, I'm afraid that people say, "Well, see, they didn't know what they were doing." It's like, I think the better perspective is that we're learning together, and we're making the best decisions we can based on available information that may change over time.
Cool. So let's go back to your time at St. Paul's. Then, what were some of the biggest takeaways you had when you graduated from your time there?
Well, this is very much on the spot. Just keep this in mind. And so whatever I'm about to say is really what immediately comes to my mind. But I enjoyed the camaraderie very much. I didn't know that I'd be on this path when I started, and I made a lot of mistakes getting there. And St. Paul's allowed me to make those mistakes, and so was very supportive. So that was really something that comes to mind. I had great teachers. I can name so many, like, Len Sitter, Johnston Smith are just two of them, but many great teachers that were incredible role models for me. I really had an amazing experience at St. Paul's, and it taught me and I think one thing that encoded in me very early is to have a career, to lead a life that I thought was larger than myself. I really feel very privileged each day where the goal is to help as many people as I can, and I do that on a one-to-one basis, sometimes with patients, but with clinical trials, I feel I get to do that at a population basis, and so it's a scale that is even quite different than the standard patient-doctor interaction. And I feel like that's something that St. Paul's challenged me to do from the beginning, is to think about a piece you can play in the world, not the world as it revolves around you.
So do you find yourself, are you connecting with other fellow St. Paul's grads in your career and stuff, or are possible patients that are grads too?
Well, for sure. I mean, I'm back in Winnipeg now from Ottawa, and the St. Paul's community is very much entrenched in Winnipeg, so I see those people in patient-doctor interactions and social interactions. I have a very small group of friends that I connect with regularly from from school, but it's not because of some exclusionary reason. It's more because lives get busy, and as a father and as a husband and as a physician, it's hard to fit in time. Like everyone else has that challenge, and so some of the interactions aren't as with graduates aren't as regular as you'd love to make them, and that's just the reality we all face.
Yeah. So I'm just going to ask you a couple more questions. And again, I want to respect your time too. So
Yeah.
what advice would you have for the St. Paul's grads of 2020? Because obviously there's going to be possibly no graduation ceremonies that's normally held in June. So, what advice would you provide for them?
Wow, that's a great question. I would say I'd have to think about that. I don't like to shoot from the hip, but again, immediately to my mind, messages that you will hear in St. Paul's will come back, and or will stay with you throughout your life. Like to be a man for others, to be something greater than who you are, to lead a life that's larger than your own. And be part of that. How can you contribute to society? Are things that I hope have been encoded in you, and you'll take with you as you figure out your path in life. The journey might be long. I would say that too. Like life is a marathon, not a sprint, and be in it for the long haul. Like the short wins may not be, and largely aren't where you need to direct your energy, but do think of directing your energy into something that's very long-term sustainable, that you can see grow and develop over your whole life, and don't be afraid to make that commitment, because I think the benefits to society, to your personal growth, will be immense along the way. For me, I don't even know what the end is anymore. It's just about the journey, about self-discovery, about knowledge generation, about being the best physician, the best investigator, father I could be. And it's all about discovery along the way.
I think that's sound advice, and one that could be even applied to all of us, that even though we graduated like 30 some years ago, I think it's still a great advice to live on it. And you're right. I think we all do reflect back at our times at St. Paul's and learn how we can, still continue to be a man for others and serving our community. So the last question I'm going to ask you, and it's kind of a fun one. So you may have seen a couple of weeks ago, Brad Pitt portrayed Dr. Anthony Fauci on a Saturday Night Live skit. Which actor would you want to portray you on a Saturday Night Live skit?
I mean, I don't know how to answer that, honestly. I don't know what I don't know what my idiosyncrasies would be that would and who should portray them. I wonder if someone else would be. You should ask, Blair Batchelor or Demian Highwarren, who that should be. Like, these are the people that I graduated with. I bet you they could say that better than I couldn't imagine me being portrayed at that level ever. That's the truth.
Well, yeah, you never know. Who knows? But we definitely are living in unnerving times, and we greatly appreciate all the medical workers and the first responders and their families for being on the front lines. And so, Ryan, on behalf of all of us, thank you so much for taking a few minutes with us in your time. I know you've got a very busy schedule overall, and thank you very much for your dedication in trying to find a vaccine for COVID-19. We're all trying to make the best out of it, and really appreciate all the stuff you guys are doing to help us out and providing some guidance in our life right now.
Well, it's a privilege. Thanks for reaching out. I still feel very connected to the St. Paul's community. I feel I'm in a very privileged position that I can help direct therapeutic priorities for COVID-19 in Manitoba. I hope, and I really think, that some of these therapies that we're studying will work. And when the dust settles on this pandemic, a lot of people will reflect on what they did and how they contributed. And I feel really proud of the team that I'm part of for the contributions that we're making every day. So, thanks for reaching out. And I appreciate I appreciate the opportunity you've created here.
Well, and again, thank you again. So take care, and God bless, brother.